Hi students, so this week I want to talk a little bit about death and dying and specifically gear and talk about euthanasia. Um, Euthanasia has been a common topic lately, probably in the past decade, within many countries, including the United States. And it's something that I think as healthcare professionals we need to be knowledgeable and aware of. Okay? So, euthanasia, what is it? So, pretty much euthanasia is taking the deliberate action to end a life. That's pretty much what it means. There a couple different types of euthanasia that I like to talk about. You have involuntary and voluntary euthanasia. So what you need to ask yourself is, what does that mean? What does those mean? So voluntary euthanasia is when a patient signs consent to end their life, pretty much. So they feel that they're ready to move on, and they are okay with that, and they have the knowledge to do so and to give the healthcare professional, the provider, physician, consent to end their life. You have involuntary euthanasia. Involuntary is when the patient isn't able to give consent, but someone, say a family member or the next of kin or whatever, spouse, sibling, child, or whatever, provides consent for them for the euthanasia. Usually involuntary is when the patient isn't, pretty much not able to provide consent for themselves. Okay, so those are two different types of consent. Currently, voluntary euthanasia is not legal in all the 50 states in the United States. It's not legal in all of those. As of right now, the only ones that I am aware of that does that is Oregon and Washington. So it is starting to become more common and more available within the United States. There are also two types of procedure classifications with euthanasia I'd like to talk about. You have passive and active euthanasia. Passive euthanasia is usually when the patient is given medicine that ends their life slowly. For example, like an opiate or something, like upping the dose, physician upping the dose of an opiate that could possibly cause death to the patient. Now, passive euthanasia is usually unintentional. So the physician that is working with a patient, they're not aware that they are hurting the patient that way and possibly causing death to them. So that's passive euthanasia. Active euthanasia is when the patient is actually given something to end their life abruptly and quickly. So that's active euthanasia. So there's several different scenarios that euthanasia can be involved in. Some of them are intentional, some are unintentional. It's hard to say, but it is a topic that can be, very hard to talk about with patients and healthcare professionals. It's something that, no patient wants. Most patients, are not ready to pass on, and they want to live as long as possible. So it's definitely something that is, harder for people to talk about. But anyway, you will have an assignment this week talking about death and dying, and euthanasia is one of those topics that you will be discussing. So I just wanted you to have some knowledge of what that means, the different types of euthanasia that are involved, and how they are, how euthanasia is pretty much looked at in the United States. So like I said, it's not very common, but I do think it will become more common as time goes on. Okay, so if you have any questions this week, feel free to contact me.